Ivy Rehab Injury Report with over 18 locations around South Jersey offering best-in-class outpatient physical therapy. Dr. Jaden Hoth joins us right now on 97.3 ESP. Dr. Jaden, how you doing today?
Hey, Josh, doing well. I had some issues with the computer, so just got it with the phone here. Hope that the audio is okay.
You sound loud and clear to me, so we are good to
Perfect.
go here. Um,
Great.
um, we have a bit of a different conversation today because we have two different athletes in Philadelphia sports who have similar injuries. But as you know, as someone who does physical therapy, there is a big difference. So for those who haven't heard, Andrew Painter, who left the Phillies game on Wednesday night, he has been diagnosed with what is being called tightness. But Makai Lemon has a hamstring strain. So while Painter is expected to return in a few days to pitch, there is no timetable for Makai Lemon to return. So explain the difference between what exactly is a hamstring strain versus hamstring tightness.
Sure. And yeah, tightness is obviously a vague statement that we get there from the MRI. So without seeing the MRI and seeing exactly what they've seen there, I have to speculate that they're seeing some development of what we would call like tendinopathy or tendonitis that's occurring, perhaps in the tendon and somewhat in the muscle as well. Uh, so it could show up on an MRI that we're seeing like a pattern of micro tearing and healing in that hamstring with Painter that's causing him to give that diagnosis of tightness. So while everything is intact, the muscle is intact, you can see that there's been a history of micro tears in the past that's causing it to be tighter and to not move as well during regular movements. So that's the difference where I would say with the diagnosis of tightness compared to an actual strain is tightness, the hamstring is intact, the muscle fibers are there, but you can see that there's been a history and pattern of micro tearing and healing that's caused some scar tissue formation. That's caused the muscle to not obviously still not be in a 100% normal state.
So now, for someone who has been diagnosed with tightness, you have an athlete like
Mhm.
Andrew Painter. He's doing a repeated motion again and again. He's not doing a variety of different things, not running around like a wide receiver would. So, can that injury impact his repeated motion?
Sure, and kind of like we were talking about, right, with that tightness diagnosis, it basically is showing in the MRI that he's had this consistent repetitive pattern in the same motion that has started to wear on that hamstring, causing that tightness, causing it to be more prone to potential tearing or injury as he keeps going as he is. I'm sure, with his physios and the PTs and trainers that they're working on that with him as much as they can. So when it comes to having that tightness, he's consistently doing the same motion over and over, landing on that leg, and the hamstring gets that a lot of load that it has to endure time and time again with a lot of load and power that's being stressed to it. They're trying to train that specifically with the rehab, and they're trying to help his body heal and recover as much as it can in between all of the reps that it's taking. But essentially, we've kind of got a case of it's starting to just be I like to say in the clinic overworked and underpaid. So we've got to we got to figure the balance out as how can we pay that muscle and those tendons more or work it less? You've got to restore the balance there. So in one of those ways.
So, Painter is right now scheduled to start this upcoming Monday. So he's got a few
Hmm.
days until he's back on the mound. So, if you were his doctor, his physical therapist, what are you watching for from him to make sure that, because he might say, I'm fine, I'm good. But is there anything maybe when he does take the mound on Monday that you would be watching for closely?
Sure. I mean, even before you're even talking about getting on the mound, going through a number of tests and assessments to make sure that hamstring isn't showing any signs of clear weakness or pain. You're going in and you're palpating along the muscle as well, seeing if you find any areas that you can feel tightness or that are triggering pain, any trigger points in the area. So first and foremost, just assessing him on the clinic table and making sure that he's passing all of those assessments fine. And then yeah, when he's on the mound and playing, you're looking for any as you know any drops in performance could be indicative of where the muscle is starting to not behave as well. So drops in performance, athletes can be pretty good at hiding the pain sometimes because they don't want to come out. So that's also with them. They're having discussions on what we're looking at here and helping the athlete understand as well. Sometimes a short timeout is better than pushing through pain and then having to have a long timeout Most of these guys start to understand that, but depending on the game and the importance of those personal factors, it can affect an athlete's decision as well, right? So, but on the mound, you're looking for is he yeah, compensating in any way? Is he doing less on the landing through when his follow through, all of those things. But those should be all discussions that are had well beforehand. So it's not an in-game decision at the moment. It's already there's a plan in place. Like, okay, we start to feel this, or even in the warm-ups we start to feel this. Then there's already a plan in place of what are the actions.
We're talking about Jaden Hoth, of course, Ivy Rehab Physical Therapy Centers, over 18 locations around South Jersey, offering best-in-class outpatient physical therapy. I can say that because they were my physical therapist. That's why we recommend them here on 97.3 ESPN. So now we have a better understanding what Painter's going through. Let's flip it over to Makai Lemon. And I wanted to start with this. There's a lot of people who are not medical experts. They're not physical therapists. They're not, any doctors. But it's always been suggested that certain athletes are more susceptible to certain injuries than others. Do you think that that is true? Is that theory valid?
Yeah, you're asking like from the perspective of their body composition, what their appearance, their size, perhaps.
Yep.
I mean, anyone can see if there's a patient, if there's a athlete that has the tendency. We can all see like, oh, they were injured last year and then they're injured here this again. We can all have that pattern recognition. And you can say, oh, if they're getting injured each year, then yeah, they might be more prone. But from a strictly body composition state, I mean, every person is different, and just what you see on the outside doesn't necessarily dictate what's going on the inside. I would say in the case of football, where there's a lot of you've got a lot of impacts and player versus player, that can maybe help you determine a little bit, right? So in the case of Lemon, he's playing and he's having to tolerate forces being put on him from other players, right? Now, if he's just he's a track runner and he's just running and it's just his own loads that he's having to bear each time, I think it's harder to make that determination. But when we see a smaller individual and he's going up and he's having to bear loads from other larger individuals, tackling and pulling on him, it could make you question, their resistance to those loads time after time if they're a smaller athlete. But I think each individual is different. I think to just say they're small, they're going to be more prone to injury, just based on how the athlete's looking. I think that would probably be a fallacy. Obviously, though, I mean, physics are physics, and you see a smaller player and they're being consistently hit and pulled on by larger, more powerful forces on the players. Yeah, the physics, and we can all tell that that would be a mismatch there. But I don't know if that answers the question. I'd say
Well,
depending on, but yeah.
it leads us to the next question because Makai
Mhm.
Lemon had no injury history in college. He started 30,
Mhm.
32 or 33 straight games for the exact number. But still,
Mhm.
when you start that many games in a row in college and you have no injury, right? And now you get to the NFL and you have this hamstring strain when practicing, people want to know, what could this be? What could be the reason why a guy who doesn't have an injury history would all of a sudden show up in the NFL training camp and then have a hamstring strain?
Sure. And as these athletes go, I mean, he's now gone from college to pro. I'm sure the level is higher. The demands on his body have taken a jump up. And sometimes when you get that sharp climb from one level to another, and the body hasn't had enough time to adjust to that, that can be enough to tip the scales when we see a hamstring strain or any kind of muscle strain occur. So that could be kind of an explanation of it. And also sometimes, as you're training, you sometimes just get the balance off and a hamstring strain occurs, right? So just having the one hamstring strain doesn't mean that one is going to be prone to those injuries. Obviously, the rehab is very important after a hamstring strain occurs. The research and science tells us that the power and the capability of that hamstring is diminished, even with very, very good rehab. I mean, that's the goal of the rehab, is get that hamstring as powerful as it was before. But uh, the science research shows that after a strain, it's hard to get back to that 100% of where it was, that same power and strength in that hamstring, which is why these injuries can be reoccurring. Um, but therefore, in the rehab, you're really looking to strengthen the muscle as much as you can and restore the length as much as you can to where it was before, and then practicing in the exact same formats and loading it in the same formats that they'll experience in games and training.
And for those out there who are wondering, what are the checkpoints? What are kind of like the process if someone has a hamstring strain specifically, if they came to you at IV Rehab Physical Therapy and they're like, hey, Dr. Jane, I got this hamstring strain. What is kind of the process they would go through? And what are the checkpoints they have to hit before you give them the clearance to get back to regular activity?
Sure. So there's a variety of different tests you can do. Essentially, the pain is a big guide along the course of training. You test the muscle normally just with first manual muscle test where you're pulling on the assessor or the PT. If they can do that kind of activity without pain, then you can start to load the muscle in just progressive formats. And there's a lot of open line of communication of, okay, how are we feeling with that loading? And then you just incrementally go up from there. uh, there's the protocol for a muscle strain. You typically start with the isometric loading of the muscle. As it's able to handle isometric loading, you then add eccentrics into the loading, and then from there you start to develop more of a concentric, eccentric dynamic, and loading it how they would see in a game format. So essentially, along the line, as you're going through that protocol progression, you're doing a lot of palpation. If we can touch in the muscle and we can get areas of pain, then we know, okay, there's still damage there. But if we can dig into a muscle with palpation and we're finding that in those areas, okay, there's no pain even when we're touching on it, then we can sense, okay, there's a lot of healing that's occurred. And then when we start to load it, and the athlete's saying, yeah, I don't feel any pain there. And you're always comparing it to the good side, right? Good versus bad. Are we able to produce the same forces? Is it feeling similar? And so you just are taking those incremental steps and constantly cluing in, okay, does that feel the same? No, and then you can load from there. You're trying to, and then I always coach the athletes. We're trying to avoid those ouch moments, trying to avoid those moments of pushing too far too quick. Because every time you are having that moment, you're like, oh, felt that. That's a sign we're starting to add too much. We're pulling and straining on the muscle again, and inhibiting the recovery.
And really quick, and one more point on that, because you mentioned about comparing the each side of the hamstring, the good hamstring with the bad hamstring. Where does like stretching come into that conversation? I know a lot of people have talked about the elasticity of muscles, and so like where does, because people might say, are you stretching enough? How many times have kids heard from their parents, did you stretch before you played, right? Or older people be like, I got to stretch before I played basketball, right? So like, where
Mhm.
does the stretching part come into this?
Sure. I think stretching is one of those things that in the past has been maybe a little bit overemphasized. Stretching obviously has its place and its importance. And yes, a strain needs, a lot of times strains occur because the muscle is not long enough. It doesn't have enough elasticity to it. But as I had one of my instructors tell me before, you can have a muscle that's shorter or not as elastic, but then it must be strong to tolerate the loads. Because the worst case scenario you can have is a muscle that's not stretched and a muscle that's also weak. That's the worst case scenario. And so the goal is a muscle that's got enough elasticity, but also strength and power through that elasticity. So if my recovery program is only stretching but no strengthening, then yeah, I've got a longer muscle but with less control, more elasticity but with less power to tolerate. And there's obviously different kinds of strains. There's a strain that occurred because there was too much load on the muscle, and then there's overstretching strains. And so if I don't stretch, then I'm also at I'm causing a propensity to then have an overstretching type strain. So all that to say, long short story long. Uh, yes, we want to stretch. I'm not one that believes in just cold stretching, a muscle that's cold and not warmed up. I believe more in kind of the dynamic stretching and then after activity stretching. I think a common fallacy is, oh, we just pull the muscle, oh, start stretching it right away. That's actually not what we want to do. If we know we've pulled a muscle, you actually don't want to just sit and stretch on it, because now you're pulling and stretching out fibers that are already torn. And so in those cases, you want to actually just get some range of motion, but without actually trying to tug on it in a stretching format initially. That's more towards the end of the protocol, is to trying to lengthen that muscle after it's already healed. Uh, and so that's where we look with stretching. So yes, want to keep the athlete, keep the muscle moving, try to increase elasticity, as you mentioned, and length. But as you're doing that, you also need to make sure that the muscle has got the strength and the power through that range of motion that you're creating as well.
Great stuff today for Dr. Jaden Hoth. Of course, he is IV Rehab Physical Therapy. You're at the Hamilton location, right?
Yes, Hamilton, New Jersey.
Absolutely. So Hamilton, New Jersey is where Ivy Rehab is as well. All over South Jersey, over 80 locations offering best-in-class outpatient physical therapy. Like with Dr. Jaden Hoth joining us today here on 97.3 ESPN. Great stuff, Dr. Jaden. Appreciate you overcoming technology and getting on here today.
Thanks for having me. Glad we can make it.
Absolutely.
All
Josh
right.
Hennig, hanging with Hennig here on 97.3 ESPN FM, 97.3 ESPN mobile app powered by First Bank of Sea Isle City. Great stuff there from Dr. Jaden Hoth. And I think it's very important to emphasize the fact that, a lot of what we're talking about is being done under supervision. Okay. So a lot of what we're talking about when it comes to rehab, physical therapy, what is the right type of stretching, the wrong type of stretching, when you should or shouldn't do some of these things, especially when it comes to a muscle like the hamstring that is such a large muscle group. That's why, you do want to go get the experts at like Ivy Rehab Physical Therapy to help take care of you. I think it's a huge part of that conversation, which is you want to make sure you're not just doing it on your own, because I learned myself, look, when I have had my own injuries, especially last year, the complications and the layers that went with my injury, I needed to make sure I had somebody who could give it, a better understanding and perspective of what I was dealing with. And if I didn't go and get that help, I wouldn't be able to sit here and talk to you about how I'm feeling better today. Now, do